Hey everyone, so today we're going to talk about logotherapy in treating ADHD. So, logotherapy, developed by Viktor Frankl, is a form of psychotherapy that focuses on helping individuals find meaning in their lives. While it's not a direct treatment for the neurological aspects of ADHD, like medication would be, it can significantly complement other interventions by addressing the existential and motivational challenges often experienced by individuals with ADHD. Here's how a logotherapy therapist might approach treating someone with ADHD. Shifting focus from deficits to meaning. Instead of solely dwelling on the challenges of ADHD, inattention, impulsivity, hyperactivity, a logotherapy therapist would help the individual explore their values, purpose, and what truly matters to them. When tasks or goals are connected to something meaningful, the internal hurdle to start and sustain effort can become much smaller. Enhancing the will to meaning. Logotherapy posits that the primary human drive is the will to meaning. For individuals with ADHD, a lack of meaning or purpose can exacerbate feelings of being overwhelmed, unproductive, or stuck. The therapist would work to awaken and strengthen this will, helping the client identify and pursue meaningful goals even amidst the difficulties of ADHD. Promoting responsibility and choice. Logotherapy emphasizes that even in challenging circumstances, individuals have the freedom to choose their attitude and response. For someone with ADHD who might feel controlled by their symptoms, this can be empowering. The therapist would guide them to recognize their agency in how they approach their challenges and make choices that align with their values. Techniques used in logotherapy for ADHD. De-reflection. This technique helps individuals shift their focus away from their problems and self-absorption. For ADHD, this might involve redirecting attention from the frustration of a missed deadline or an impulsive act towards a larger, more meaningful purpose. For example, instead of fixating on a mistake, the therapist might encourage the client to consider the valuable lesson learned or how that experience can contribute to their growth towards a desired future. Socratic dialogue. Through open-ended questions, the therapist helps the client explore their values, beliefs, and sources of meaning. This can be particularly useful for individuals with ADHD to clarify what truly motivates them and to connect their daily actions to their deeper aspirations. For example, a therapist might ask, if you could accomplish one thing that would make your life feel truly purposeful, what would it be? And paradoxical intention, less direct but potentially applicable. While primarily used for anxieties and phobias, in some contexts it could indirectly help with ADHD-related issues. For example, if someone is overly anxious about making a mistake due to inattention, the therapist might encourage them to intentionally exaggerate the mistake in their mind in a safe, controlled way to diminish its power and reduce the associated anxiety. This helps to break the cycle of fear and avoidance. Finding meaning in suffering or challenges. Logotherapy suggests that meaning can even be found in unavoidable suffering or difficulties. For individuals with ADHD, this could mean reframing their struggles not as proof of incapacity, but as part of a unique journey that can lead to resilience, creativity, or empathy. Integration with other strategies. It's crucial to understand that logotherapy is not a standalone cure for ADHD. It works best in conjunction with other established ADHD management strategies such as medication, organizational tools, and behavioral therapy. Logotherapy provides a motivational and existential framework that can give direction and purpose to these more practical interventions. In essence, a logotherapy therapist would help an individual with ADHD understand that while they have a neurological condition, they also have a unique spirit and the capacity to find meaning and purpose in their life, which can significantly improve their resilience, self-efficacy, and overall well-being. So what do you think about how a logotherapy therapist would apply those concepts to ADHD? Leave your thoughts in the comments, and I'll see you next time.